Welcome to the Onda Health Journey in making healthcare more accessible in Guatemala. We're here to change health, change opportunity, and together change tomorrow. A ripple changes everything. Over the next few minutes, we'll share what drives our mission, introduce you to our team, including local partners, explain the first step in our mission, building a healthcare facility in Parula, Guatemala, a lifeline that doesn't otherwise exist in this region. And finally, we'll share how you can join our ripple of change. In Spanish, Onda means ripple. It's the ripple effect concept upon which our mission is based. One action, one motion that starts a wave of change and transforms lives. Our mission is to improve health equity and well-being in Guatemala. We will empower people to overcome barriers to healthcare access, obstacles like ethnicity, poverty, education, and language. And by providing care to this historically marginalized and underserved region, we will change the trajectory of generations. This is an investment not only in one village or community, but will impact an entire region. Indigenous populations tend to live in more rural areas, making it more difficult to access government-run health systems that are concentrated in metropolitan cities. This leaves most indigenous people without access to fundamental care. In Parula, 95% of the population is indigenous Maya living in remote, cloud forest mountain villages. Poverty hinders access to healthcare as people can't afford the time and cost to travel to areas where care is available. In Guatemala, despite having a universal healthcare system, patients must pay for testing, medication, and supplies. In Parula, nearly 80% live in poverty, and 36% of those are considered extreme poverty, surviving on less than $1 per day. Education provides people with skills to better care for themselves. In Guatemala, the average rural education is third grade. Boys are slightly more likely to complete a higher grade, but most often, kids are pulled from school due to cost or the need to help at home. Most public schools do not teach health concepts or anatomy. In Parula, only 30% of the region's residents can afford an education for their children. There are 23 recognized national languages in Guatemala, 21 of which are Mayan languages. Most doctors and healthcare staff speak only Spanish, which is a significant barrier for Mayan language-speaking people. And language interpreters are not required or provided as they are in the U.S. healthcare system. In Parula, over 80% speak a Mayan language, meaning a majority of the people here are unable to communicate with a doctor in the urban healthcare facilities. The founders of Onda Health are no strangers to Parula or its surrounding communities. This region is comprised of resilient, hardworking people, yet struggle daily to meet their families' basic needs. For many, navigating the national healthcare system is an obstacle impossible to overcome, and their health suffers for it. Guatemala's constitution guarantees universal health care, but with healthcare expenditures being the lowest in Central America, the system often lacks basic medicine and equipment. And with 70% of the nation's physicians centralized in urban areas, not all Guatemalans have access. The system is challenged by limited resources, too many patients, the cost to provide care, and poor infrastructure. Despite being the largest economy in Central America, Guatemala has the lowest human development index of any country in Central America. Nearly 1.5 million Guatemalans live in corrugated metal homes of scavenged materials and dirt floors. These living conditions create a cycle of poor health through constant parasite infections, diarrhea, anemia, malnutrition, and stunted growth. An indigenous person in Guatemala has a life expectancy of 13 fewer years than a non-indigenous one. And the maternal mortality rate is more than twice as high. Small health centers provide care in rural areas like Parula, facilities that are understaffed, under-equipped, and unable to deliver comprehensive care. The absence of health equity and access to care leads to devastating consequences. It's all too frequent to see a child with severe asthma that's likely to go without treatment and miss school to avoid a respiratory attack. A farmer with a hernia who can't afford the time and cost to travel for surgery and becomes physically unable to provide for his family. Parula is a rural area located in the Baja Verapaz department, a 6 to 9 hour journey from Guatemala City, where most higher level care is available. Less than a third of the homes have running water or electricity. And this is a region still recovering from the Civil War that ended in 1996. A culture of fear and silence is still being passed on to younger generations. Health is a fundamental cornerstone of life. Without it, opportunity and growth are unattainable. We are rising to the challenge to improve health equity and well-being. Competent leadership is key to a successful mission. Our commitment stems from our service experience and a deep-rooted recognition of the needs of those living in the areas we serve. Our organization is comprised primarily of healthcare professionals who collectively have more than 80 years of experience in Guatemala. We were first introduced to Parula in 2019 by a local community development organization, Yo Guatemala. Yo founder, Brenda Lemus Gordillo, is a dynamic community leader in the Baja Verapaz region. We immediately recognized the significant impact Yo programs have had on the community and partnered with him to introduce medical services in 2021. Locals walked for miles and lined up overnight to be seen by the mission team. At Onda Health, we now collaborate with our local partners to fulfill our promise of a permanent healthcare facility that will not only expand mission service, but ensure continuity of care in a competent and dignified manner. This will be a health resource accessible to all residents, regardless of financial means, and a facility well suited to host medical mission teams and designed for comprehensive patient care. Thank you for your time and consideration. Please visit our website to learn more. Your support is vital in making this mission possible.